you doing, Miss Susan? It's nice to meet you. My name is Dr. Stokes. Come on in and have a seat. So how's your day been going so far? That's great. Okay, so what we're going to be doing today before we get started, we're going to be kind of going over your assessment, and we're going to be kind of going over your results. This is going to kind of give us a better understanding of what we need to do as far as if we need to do specialized treatment with you, if we need to maybe look at some medications or, some trauma therapy. There's just so much that we need to kind of go over. So I want to really go ahead and get started. Now, I kind of had some time to kind of go through and review your medical history, and I kind of had some time to kind of go through and do some background, get some background information on you here. So I see that you've had an extensive opportunity as far as your education is concerned, and as far as your career. You're very motivated, which is such a positive thing, even in the midst of everything of you that you're going through with your depression and your anxiety. And I even see here that you had some history from high school up into the present time where you have dealt with anxiety and depression. Is that correct? Okay. So one of the things that I kind of want to talk to you about as I was going through and kind of looking through your assessments, some of that very areas that you were struggling in as far as your assessment were concerned were areas that you've already have had some history struggling in. So a lot of times I always try to tell patients when you come in, I don't want you to be discouraged because you did fairly well on a lot of your other testing. It was just the areas that you already struggle in, as far as your mathematics are concerned. And then we even see where you've had some issues with some ADHD, and that definitely will affect your your concentration. It will affect how you test, because a lot of times I can see where you've needed a little extra time to test. And so definitely that plays a major factor when you are going in and you're trying to get assessments completed in a certain amount of time. Definitely, if you have issues with ADHD and other issues where you need a little extra time, that definitely will reflect on these tests on these assessments that you're taking now. And so let's go ahead and get into your test results. So I saw where you, you graduated high school, and then you automatically I think you went into college, and you were in college for a year, and you had kind of had some issues there, and you decided that you wanted to enlist into the Army, right? Okay, yeah, and then you went there for about 9 months. Now, what I wanted to address, when you were already kind of dealing with depression and anxiety, and then there was an incident with some gunshots that had taken place, and it kind of had brought on some even almost worsened your stress level, and it kind of brought on some acute symptoms of stress. Okay, so really, when you were already kind of dealing with stress factors, going into environments, military, army, law enforcement, areas that are going to already add to your stress level, may not be the best thing for you to do when you are already kind of dealing with anxiety and depression issues, because then you may be leading more into post-traumatic stress. So you kind of, if you're not properly dealing with those issues, and then you're going into environments that are going to actually add on to your stress level, it's going to actually worsen your condition rather than making it better. And so definitely it's a good thing that you decided to take those steps to get the help that you needed, because we definitely want to be able to for you to have some relief. But also I want you to understand that you are 29 years old, and you're very active in school. You have your part-time job going on, your education, and you're also married, your wife, and that in and of itself can be very stressful on you. So I don't want you to feel like you're going through something by yourself, because there are a lot of people who are professionals, who are working professionals, who are dealing with some type of stress-related issues. Not all, but you'd be surprised of people who are in the professional field, doctors, lawyers, even in the medical field, who deal with anxiety, who deal with depression, because on a day-to-day basis, you're coming in contact with so much. And a lot of times it's hard mentally to process everything. And so that definitely can add to your stress factors. So we don't see that you have a history here, a family history of any depression or anything that has taken place within your family genetic history. But also, when you're looking at, I see where it says that you have a long-standing history of anxiety and depression since high school. So obviously, what happens is a lot of times mentally, when we have gone through things that are very traumatic in our life, we tend to want to, our bodies and our minds want to keep us safe. And so a lot of times it'll repress a lot of things that we've gone through. And because you have never really dealt with it, because depression and anxiety just not, it has to come from somewhere. So definitely not dealing with those issues can definitely worsen as you get older, as you begin to get into your career, as you begin to marry, as kind of finding your way in life. Those things have a way of kind of, if you don't deal with them, they have a way of kind of taking a toll on you. And so definitely we want to be able to address those issues. So we're going to go ahead and get into your test results here. And again, I want you to understand, I want you to be uncomfortable with anything, because again, a lot of the areas that you tested lower on were areas that you've already struggled in. So when we look at your cognitive abilities, it says that you tested that you're right around the least average in your performance. And on your subtest, as far as your both your verbal and your nonverbal performances on those areas, you tested pretty fairly. However, there was some weaknesses as far as the subtests were as it was concerned dealing with the subtest. These were areas that you tested kind of below average on. And again, it could be possible like that. The test always gives that range for anxiety, and of course, if you've already had issues, if you already have anxiety, test anxiety is a major thing when you're dealing with going in. A lot of people have test anxiety, and if you already have anxiety on top of going in and having to take tests and different things, that definitely can have effects on your test. So when we go through and we look at your achievement, again, the math was an area that you kind of struggled in. But again, that's always been one of your weaknesses. So one of the things that you can do when you're struggling in areas, even though we know what our weaknesses are, when you're struggling in areas, you definitely kind of, maybe take a math course while you're in school, or, maybe get you some resources that can kind of help you strengthen your math. But those were areas that you kind of struggled in as far as your mathematics were concerned. Okay. And then when we're looking at your reading and your spelling, comprehension, these were areas that you kind of performed at a regular expected range. So these are areas that you actually probably excel in. On a day-to-day basis. These are not areas that you struggle in, and so quite naturally you're gonna do a lot better on those areas than you would on areas that you have issues in, such as your mathematics. And then on your attention, again, we know that you have some issues with ADHD, and there were some issues as far as your testing, as far as your attention and your memory were concerned. And it said that you kind of tested a little bit low on those areas. So again, with your calculations. So these are all the areas that you already, have had some issues in since high school. As far as your ADHD, we know that that's going to affect, it's going to affect your attention. It's going to affect your memory. As far as your calculations with your arithmetic and your mathematics, those are areas that you kind of tested low on. But those are also areas that you can also improve on as well. And your language and your speech was very fluent, which is a very good thing. Okay, let's go on down a little bit farther. And even in your memory, it said that there was no evidence of primary retentive memory problems, so that is really, really good. But you did, have some issues with mild impairment as far as learning, which again goes back to that ADHD, or, having some issues kind of with your memory and remembering things and remembering how to cognitively how to be able to pull everything together. So again, that has a lot to do with going back with your ADHD and your learning how you are able to learn. You may not be able to learn like everybody else learn. Everyone learns at different paces, and so sometimes being able to have that little extra time in between, or giving you a little bit of extra time on your test can definitely make a difference. One of the major things that I wanted to be able to discuss before we close out is your personality and your mood. Now, these are areas that when we look at the MMPI 2RF, that we were able to see that you did have some issues there. As far as your mood and your personality were concerned, we could see that you did have some issues dealing with depression and your tension and agitation. Again, depression definitely brings on agitation and tension and anxiety, and cause you to feel anxious, all the time. So those are definitely areas that that you scored kind of low on. Those are areas that we definitely want to focus on. So when we look at your overall testing, it was not bad. The only thing that you have to work on is, as with anything in life, you have to work on those areas that you struggle in. So we know that you struggle as far as, your attention is concerned, as far as your mathematics are concerned. And because you're dealing with anxiety and anxiousness and mood, then of course, looking into your mood, and as far as as far as your personality is concerned, those are areas that we want to work on now, to make sure that we can kind of give you some kind of relief from those in those areas. So my suggestions would be that we definitely want to get you into some trauma therapy, and we want to kind of see where your depression and where your anxiety originated from. We kind of want to be able to get you into some cognitive therapy and get you into some behavioral therapy. All of those things are going to begin to work on, your depression, your anxiety, what is causing you to be anxious. Are you having any type of things that are taking place at home that we need to address? We definitely want to get you on some mood stabilizers that are going to be able to kind of stabilize your mood and kind of keep you level, because you are functioning, you are working, you're continuing to go on and be able to complete your day-to-day activities. And we definitely don't want the depression to worsen where it begins to affect your day-to-day activities. So with that being said, it was definitely nice to meet you, Miss Susan, and I think that you have an awesome opportunity to get a hold on your depression now, as opposed to most people come in when it has gotten to its worst, and hospitalization becomes a factor, and it opens up doors for other mood disorders and other mental disorders to happen. And so we want to be able to get down to the bottom of what's causing your depression and what's causing you to feel anxious, and because if you don't get down to the bottom of it, it's going to begin to affect your daily life and how you function, and we definitely don't want that. So what we want to do is we want to go ahead and get you in and go ahead and get your paperwork worked up on you, so that we can get you started on your therapy, get you started on your meds, and then we want to definitely set some type of support group up for you. We have support groups here. We have support groups over at our other facility, weekly, that you can come in once a week, an hour, and be able to sit in and be able to kind of go through. Sometimes just talking about things, can do great, can be great help factors in your life, as far as when you're dealing with depression, because you're dealing with, you're in a group, and you can be able to exchange numbers and different things and have a support system to let you know that you're not going through anything by yourself. That sounds like a plan? Okay, well, it was so nice meeting you, and I'm going to leave you my number so that we can follow up. If you have any questions for me, now would be a good time for you to ask, or you can always call, and my secretary will patch you right on in through me, or you can reach me on my cell. Okay? It was so nice meeting you, Miss Susan. I want you to stay encouraged and enjoy the rest of your day. Okay? All right. Bye-bye.